Hey everybody, welcome to my YouTube channel. My name's Mike Worrell, your friendly independent agent and creator of MedicareCost.net. Today we're going to go over the difference between Plan F and Plan G. Which one's the best? We're going to go over the benefits and we're going to go over the rate increases between the two. So first thing is, I put a cutout from the Choosing a Medigap guide, which is created by the federal government, and it shows what all the Medicare supplements cover. But today we're just going to look at the Plan F and the Plan G, the two most popular plans. And as you go through everything that they cover, you can see they're pretty much identical. The Plan F and G, they're both going to pay that Medicare Part A coinsurance. They're going to pay that Medicare Part B coinsurance. They're going to pay for the first 3 pints of blood, the Part A hospice care. They're both going to pay for skilled nursing facility care. They're both going to pay that big Medicare Part A deductible. And now you can see the only difference between the two is the Medicare Part B deductible. Otherwise, they both pay the Part B excess charges, and they both give you foreign travel emergency for outside of the country. The Part B deductible is $183 one time a year. And how the Medicare Part B deductible works is before Medicare Part B, which is your medical, before it starts paying 80%, you have a $183 deductible to pay. The Plan F pays that for you. The Plan G does not. Otherwise, the plans are line item identical. Now let's go over the cost between the two. I picked a zip code in Texas, 75001, Dallas County, and this is for someone, a female turning age 65, non-smoker. And as you can see on the left, I have Plan F, and on the right, I have Plan G. And these are just the 6 lowest priced companies for Plan F and Plan G for the criteria above. Age 65, female, non-smoker. And so you can see Philadelphia American comes in with the best rate for F and G for this lady. And if you take the premiums, I put $119.98 down here on the left. And for Plan G, $93.22 for Plan G. And so if you subtract the two, you get a difference of $26.76 a month. And so we want to factor that out over a year. So we take the difference and multiply it by 12, which is 12 months in a year. And you get an annual difference of $321.12. So the difference between the F and G in annual premium right at age 65 is $321 for this woman. When the only difference in coverage is $183 annual deductible. And so right down here, we took $321, subtract the $183 deductible, and we have a savings of $138.12 with Plan G. And that's just in the first year when someone's turning 65. So this lady will get charged an additional $138 in premium for Plan F to basically spend her money for you. So Plan G is the most cost-effective option for her, even right at age 65. So now let's talk about rate increase differences. I'm just going to keep it simple, use the same figures from the slide before. Philadelphia American's G at $93 a month and their F at $119. And so I've been doing this a long time. I've been helping people on Medicare for almost 8 years now. And the Plan G's premium increases are about half what Plan F's are on average. So the G usually gets right around a 5% premium increase a year. Sometimes it's 4%, sometimes it's 6%. And then the F usually goes up about 10% a year. And so if we use those numbers, we can factor out what someone could expect to be paying over the next 5-10 years. And so taking a look at Plan F, some 65-year-old female non-smoker in Texas, you would start out at $119 a month. And by the time you're age 70, you'd be paying $191 a month for that Plan F. By the time you reach age 75, you're paying $308 a month for that Plan F. So in just 10 years, your premium jumps from $119 to $308 a month. It nearly triples. Going over to the Plan G, you start out at $93 a month. By the time you reach age 70, you're paying $118 a month. And by the time you reach age 75, you're paying $151 a month. Much more reasonable premium increases. $151 a month is still a reasonable premium to be paying. $308 a month? I don't think so. That's ridiculous. But let's go ahead and compare the 10-year mark. So age 75 for F and age 75 for G. So this lady would be paying $3,703 annually for Plan F at age 75. Her Plan G premium would be $1,812. That's a difference of $1,891. So she would be paying more than double her Plan G premium to have Plan F for 10 years at this point. And so once again, the only difference in coverage between an F and a G is $183 one time a year deductible. Pretty straightforward that in most states, Plan G is completely the best option. So let's talk about, why do so many agents push Plan F? Why do so many people say it's the best plan? How come agents say that this is the plan you should buy? You shouldn't even consider anything else. It covers everything. That's simple. Commissions. Most agents push Plan F because Plan F pays the highest commission. Insurance agents' commissions are based off of premium. And as you saw in the previous slides, F has the highest premium, which means the agent gets a higher commission. However, Plan G is going to be the most cost-effective plan for you. And here at MedicareCost.net, that's what we're all about. I've been putting my clients' needs first, and I think that's one of the biggest reasons I've been successful is making sure that my clients can get a plan, which is usually Plan G, that has stable premium increases and something that they can afford for a very long period of time. Whereas you have people with Plan F that, as you saw in the previous slides, that in just 10 years on Medicare, if they don't change and they're stuck on the plan, they're already over $300 a month based on a 10-year annual rate increase, which is ridiculous. And that's why so many people have Plan F. That's why so many agents push Plan F, is just because of commissions. A lot of agents only are willing to sell Plan F. They don't even show people Plan G or tell them that the value that Plan G brings. With all that being said, I do want to touch on a little side note, because while most of the country Plan G is by far the best value, there are a couple of states where Plan F is usually a better way to go. California is an example. Washington would be another. There's a few states where people don't have to worry about passing underwriting, and those states tend to have a Plan F be the best premium, because G, there's just not enough difference. Like a $5 to $10 a month difference, a G is not going to make much sense because the deductible is going to outweigh the savings. But that's not the norm. For most people, G is going to be a much better value. Why does rate increase matter? A lot of people are under the impression that they can change insurance, their Medicare supplement insurance, if their premium gets too high. And you can, but you have to be healthy enough to pass underwriting. And so hopefully you can change. But if you have medical conditions, you're going to be stuck on the plan that you have. You have to be reasonably healthy to be able to change your Medicare supplement insurance. And that's why rate increase matters so much. And that's why here at MedicareCost.net, I myself, Mike Worrell, almost always recommend the Plan G. And that's because I know that if my client develops medical conditions, I know they're going to be able to continue affording their premiums over a long period of time. What you saw on the previous slide with Plan F, the Plan F's premiums get very ridiculous very quickly because the premium increases are so high. And so looking out on that longevity, on being able to afford your premium 5, 10, 15, 20 years down the road, if you have medical conditions and you can't change, the Plan G is going to save you an absolute fortune. One other thing I'd like to clear up is that a lot of people were led to believe that they could change their Medicare supplement plan at the end of the year, regardless of their health. Or another one is that Obamacare changed it for them and they no longer have to worry about qualifying with their health. Both of those are incorrect. You do always have to qualify with your good health to purchase a new Medicare supplement plan. And Obamacare did not have any effect on Medicare supplement underwriting. You still have to qualify with your good health. And the only exceptions to that are those handful of states I mentioned in the previous slide, California, Washington, and a few other states. But most of the country, aside from when you first start Medicare Part B, which most people do at 65, you do have to qualify with your good health to purchase a supplement, and that's why Plan G is the best in most states. It's going to be the lowest cost, most cost effective from the beginning. It's going to be the most cost effective over the next several years. It's just the best thing for most people. There's no reason to pay all that extra money to a Plan F insurance company just to have them pay a $183 deductible. But hey, that's it. I'm going to leave you with this. I hope you enjoyed the video. Please hit the subscribe button right down below if you'd like to see more videos from me. And hope you have a wonderful rest of your day.